we get started, and anyone else who's joining can join in.
Yeah, great. Thank you, Una. Hello, everybody. Hi, everybody. We'll get a start. Thank you again for joining us tonight at our Community Champions regular drop-in meeting. My name is Barry Causer. I work in the public health team of Merton Council, and Una works in the team too. So really pleased to spend some time with you this evening. Una, if you'd go to the next slide for me. You still there, Una?
Yeah. Is it not? It's changed on my screen.
There we go. Sorry, thank you. I'll be more patient. Apologies. So, agenda tonight, champions, as normal. We are going to give you an overview of some key messages from this week within Merton on our COVID response. I'm going to follow up the key messages, and I'm going to present some more data to you, listening to what you asked and what you told me last week. So I'm going to present some key data. Then we'll have a bit of a discussion, hopefully on last week's theme, financial hardship, and then we will talk about the new national restrictions. Things seem to move very quickly, don't they? And so it'll be interesting to get your views and thoughts on the restrictions that are going to come in tomorrow. Then hopefully we'll have some more questions, discussions, next steps, and we will get you out by 8 o'clock tonight, because I appreciate your time on a Wednesday evening. Next slide, please, Una. I think, welcome to our new champions. This is hopefully a really informative, but it's an informal session. We host these sessions twice a week. So on a Wednesday, we have a session at 12 to 1. And at that session, we have about in and around 30 champions. So it's a very different feel to the evening session where we're smaller numbers. So we get a bit more granular detail in tonight. So take a moment to introduce yourself in the chat box, but use it throughout as well. So ask us any questions on that chat box, any comments, thoughts, opinions, what you've heard in the community. We can really use it to move the discussion forward. Housekeeping wise, it's up to you if you have your camera on or off, absolutely your choice. And please mute your microphone when you're not speaking. As we are such a small group, I hope you don't mind. We'll do this again. I will ask you to introduce yourself. I wasn't able to do it earlier because there was 30 people in the afternoon session, but as we're a small session, I will just go through the list. Angela, did you want to say hello to the group?
Hello.
Which organisation do you represent, if you do, Angela?
Faith in Action Merton Homeless Project.
Thank you, Angela. Good to see you again. Kelvin, did you want to say hello to the group? No problem. Karen?
Yeah, my name's Karen. I'm a local resident. That's really about it.
That's fantastic, Karen. You were very quiet then, but we heard that you're with us. Kemi, did you want to introduce yourself? Okay, Leoka?
Hi, I'm Leoka. I live in Merton Borough and I'm just a resident.
Fantastic, Leoka. Good to see you tonight. Thank you for joining us.
Sorry,
Kamiko.
Barry, I put my mute on. So
oh, sorry. Go ahead. Go on, Kemi.
Hi, sorry about that. Yeah, my name is Kemi and I work with the MVSC and I'm also on the Merton Community Hub. So
thank you for joining us again, Kemi. Kamiko.
Hi, I'm Kamiko. I represent Fair and Square Wimbledon CIC, which is a disability employability project.
Thank you, Kamiko. Good to meet you. And Una, you should introduce yourself too.
Hi everyone, Una O'Brien, and I'm the Health Improvement Officer at the Public Health team in Merton Council.
Thank you, everybody. So now we know each other. We can have an honest discussion. We can talk. So we can have a rich discussion. So next slide, please, Una. Sorry, key messages. Colleagues, champions, what we've seen over the last week are that infection rates are still increasing across the whole of the UK, and you will know this. There's lots in the news today, the debate this afternoon, that national restrictions are going to be put in place from tomorrow. The reason those national restrictions are being put in place is to reduce the day-to-day contact with other people. So that's the main intention of those restrictions. What we've seen in Merton, that cases are continuing to increase across all of Merton, across the east and the west, and across all age groups. But what is particularly concerning is that we are seeing an increase in cases in those residents that are over 60 years of age. As you will remember, as you will know, that older people are vulnerable to COVID-19, severe COVID-19, and so this is particularly concerning for us. What we've also seen is that positivity is going up in Merton. So that means of all the tests that take place, there's a higher percentage of those that are actually positive. So the key message there is that if you have symptoms, self-isolate and get a test immediately. And what we've seen is that continuing the message that you've heard from me say before is that there is additional capacity in testing, whether that be home testing or via the mobile testing units that are available. And so hopefully people are able to access a test nearby or get that home delivery. That should be a lot more straightforward than it was a few weeks ago. If you hear other stories about people are still struggling, please let me know. Other things, looking at the indicators, there is increasing pressure, and those numbers are still increasing of those NHS indicators. So the numbers of people that are inpatients or are in intensive care are still increasing. Across South West London, they are still at the lower end of the scale compared to the rest of London, but they are increasing, and that is a concern for us, particularly when we start looking at increasing number of cases in 60+ residents. What we've seen, you will have heard lots about the app. You've heard Una and I talk about the app a lot when it was first launched as well, which was a few weeks ago now. But over 19 million people have downloaded it, and that's 40% of all over 16 people in England and Wales, which is really, really positive. What I saw over the weekend when my app got updated is they're making constant changes to the app to make it more accurate. I would ask you to continue using the app, using it well as you can, and encouraging your friends, family and networks to continue to download and use the app. Clearly tomorrow the national restrictions come into place, and so as another key message for our champions, just to remind you that within Merton we do have a community response hub. They are well placed, they are led by the voluntary sector. They do an amazing job in supporting residents, and you can access that help by the email and the phone number there. So if you or someone that you know needs support, then please get in contact with the hub. They do amazing stuff, as one of our champions in the room knows about. But also the things are changing very quickly, and so for the latest updates I would encourage you all to sign up for the Merton Council COVID-19 newsletter at the web address there. It has real practical information in there, as well as local information from the borough. So if you have any questions about those key messages, please put them in the chat or ask a question. But what I'm going to do now is to share some data with you. Let me try to do this. Sorry, colleagues, that's the wrong one. Sorry, guys. Right, okay, I've got it open. I should be getting better at this after all these weeks, shouldn't I? Right, I've got it. There we go. Sorry, champions. It's been a long day, but I finally got there for you. So you asked last week about the data, and I've had conversations with comms about how we can use local data to inform some of our comms messages. And what I'm going to show you, you saw some of these last week, is I'm going to show you 3 slides. I'm going to present some data to you. Some of this is not in the public domain, so I'm going to ask you again, please do not share it. And I'm not going to give you a comprehensive overview. I'm going to pick out some of the key data points that we have within the borough, which we use to inform those key messages. So these are the slides that Dr. Dagmar Zuna, our Director of Public Health, presented at last night's Health and Wellbeing Community Subgroup. That meeting was streamed live on YouTube, so you can, we're going to send you the link if you wanted to have a look at that community response subgroup. Because it was streamed live on YouTube, what I'm showing you is effectively in the public domain. So I'm going to show you a couple of the slides here. So there's lots of information. This is a weekly awareness report that we produce within public health for colleagues across the borough that are working on the COVID response. What I can assure you about also, champions, is that every single day we look at the data. We're looking at this on a regular basis within the public health team. The data and the numbers that you'll see and the points that I pull out are based on data from last week. So this is up to the 28th of October. Okay, and things are moving very quickly, as you can imagine. So what we can see there is at the top, the R value. So the R value is estimated to be 1.1 to 1.3 across London. And the new restrictions that come in place tomorrow, the main reason they have been put in place is to reduce that R value. So that's the reason why we're going into what people are calling this second lockdown. The next key measure that we look at is the 7-day rate per 100,000 residents. And what you'll be able to see there for Merton is that last week, so the 28th, the 7-day rate was at 125.4. And in the previous week, it was only 82. So things have gone up from 82 to 125 7-day rate within 7 days. What I can tell you, let me find it on my note, as of today, the 7-day rate in Merton is 149.6. Things are increasing rapidly. So going back to those key messages which I've just spoken you through, these are the reasons these national restrictions are being put in place. I mentioned already the concern about the 7-day rate increasing on the over 60s. So again, we can see there the 7-day rate in Merton. So on the 21st of October, that was 52. And then last week it's gone up to 60. So these are real key messages that's coming out that we need to protect our older and vulnerable residents. Looking at the testing, the positivity rate, again, I've touched on this, but I really wanted to show you the data because what I try to do for you is to use the data to give you the key messages. The testing positivity rate is increasing still. What I can say, it's not on this slide, is that 7-day rate is increasing in the 10 to 19s and the 20 to 39 age groups within the borough, but that is increasingly travelling up into older age groups. Our public health intelligence team have been looking at this and has been lots in the press about the impact of universities. What I can tell you is that over half of the university age cases got a test outside of London. So many of them are in those northern towns of Manchester and Liverpool where they're going away to university. So that has an impact on some of our numbers. But please don't take that as a positive thing. The cases in Merton are increasing and we need to be incredibly careful about this. But we have good networks, including you guys, to help us. Contact tracing is the next key thing. So SAGE, the government advice, scientists, tell us that we need our cases completed and our contacts completed to be about 80% to have an effective contact tracing system. Clearly, you can see there that it's hovering at about 75% completion for cases and 63% for contacts. What I can say is that within Merton, we are going to supplement the national system. So where the national service isn't able to contact a case to ask them to self-isolate and offer them that additional support, we are going to be taking some of those that they cannot contact locally, so we can identify and support them to be able to do that. And again, it was really interesting in the press to hear some of the feedback, and be interesting to hear your views on this, champions, is that many of the reasons given for not answering that call from Test and Trace is that it was an unknown number. So what do people think about that? Is people not answering the phone because it's an unknown number? Final bit of data there, because I know there's a lot, is about the NHS data, and I've kind of picked this up in the key messages again, but we can see quite clearly there, I can't say it, but you can see it quite clearly, that the number of inpatients and people in intensive care are increasing. I have said, South West London, they are some of the lowest in London, but they are increasing. So within the 7 days, for the example there is the number of people in intensive care has increased from 6 to 15 last week. So these are real cases. If you remember, colleagues, the increase in cases does have an impact. So an increase of people that are admitted to hospital, and these people are very unwell. And clearly the more people in hospital means there's likely to be an increase in people that require intensive care. I think I shared this with you last week, and it didn't look as purple. This is London. This is the positive cases per 100,000 residents across London boroughs. We had to create a new colour in this one. You can see where Merton is at the bottom. We are some of the lowest rates there, but they are still very high. There's a little corner of South East London last week. That's still in red, but that is still between 50 and 100 cases per 7 days. Sorry. The final slide I'm going to share with you tonight is the positive cases amongst the 60 plus. Again, I've covered this in the key messages. I'm kind of saying the same things a few different ways, but what we can see there is the positive cases in those 60 plus. There's a huge amount of red across London now. There's a huge amount of purple. If I showed you this last week, I could only imagine it's going to be even more purple on those, which is really concerning and worrying for us. So what I've tried to do is present some data so you can see the types of messages that we get, the types of data, so that Una and I can then scope into and put those into key messages. The reason we create our key messages is to give you the local information so that you can help us with a COVID response. We're doing a number of different things about community grants. We've got working with local faith leaders and leaders, but you champions are an important part of that. So sharing our key messages and the infographics that Una sends you on a Friday does play a really important part of our response. I will stop talking because it's 7:20 already. If you do have any questions, I'll do my best to answer them, whether it's in the chat or on Friday or now. So I will stop talking and hand back to Una.
Thanks, Barry. I will just get the slides up. I've seen a question from Leoka there. Are the increases in the NHS stats just COVID?
Yes, they are. The figures that I've just shown you are COVID-related in patients.
Perfect.
And again, I think there was a news article earlier that there was 11,000 people nationally in intensive care. These are significant numbers. This is why the national restrictions have been put in place. It's really worrying.
Can you all see the screen?
Yeah, we can.
Perfect. Right. I'm just going to talk through the COVID-19 community champions. Who are they and what do they do? And I'm going to be quite quick with it because I don't think we've any new champions here this evening. So who is a COVID-19 community champion? Anyone who lives or works in Merton who wants to help stop the spread of COVID-19 by sharing clear and consistent messages from the NHS and public health can be a COVID-19 community champion. We have a really good range of champions already. We're up to 94, which is great, but we're always looking for new champions to help spread those key messages. So if you know someone that you think would like to become a champion and help share these key messages, please do send them our way. The role of the champions. So it's a 3-step approach. The first is to receive the key messages that we share with you during the drop-in sessions on a Wednesday, or via email or WhatsApp on a Friday. The second step is sharing these key messages with family, friends, communities, networks, colleagues, everyone, and in the most appropriate way to you. So you can do that verbally, via email, WhatsApp, text message. And we're trying to diversify the way we share those messages with you as well, so that it makes it easier. And the third step is feeding back to us what's working well and what isn't. What are the issues in your communities? And really leading on how the discussions go in the future and our themes, because we take the lead from you and what are the issues in the community and what do we need to share with you in terms of information. And also the feeding back to us is asking us any questions. I'm going to just talk about that in this slide here. What do the COVID-19 champions not do? So our COVID-19 champions are not public health specialists or COVID-19 experts. And if you are asked a question and you're unsure of the answer or you don't know the answer, you can ask us at any time via the email addresses on the screen there. You can pop me an email. You can ask us in the drop-in sessions using the chat function. If you're in the WhatsApp group, you can always pop a question in there as well. And we'll do our best to get back to you as quickly as possible. And just as I mentioned the WhatsApp group, if anyone would like to join, pop me an email with your mobile number and I'll add you to the group as well. So feedback on financial hardship discussion. And does anyone have any questions on last week's workshop theme? Was there anything that you felt was missed or you were unsure of, you came away from and you thought about after, oh, actually, they never mentioned this? Is there anything that you felt we missed out?
Yes. Oh, gosh. I thought with the CAB, they could have done more like with their work tools, what they've got on their website, so you can help yourself a bit more. Because they normally have templates, standard letters that you could use.
Okay, right, yeah.
Advertise that a bit more, because sometimes their phone numbers, I phoned Southwest London Law Centre last week and they're just cutting you off. It's all right having a free number, but sometimes you can't access the numbers. So they should have given you an alternative. If you can't get through, you can start the process off, blah, blah, looking at our website, and you can get templates, letters, and start the process.
That makes sense, Angela. It really does, because then again, because you might want to you might go to a website to get the information for yourself, and that might mean that you don't need to make the telephone call yourself. It's kind of it's kind of self-service type approach. Is that what you mean?
Yeah, for the beginning, because I've done debt training myself, so I know they give a standard letter where you can start the process. And if you need more help, it's more complex, then call them. But to get the balls rolling, they could have said you can look on our website for certain tools that might be helpful whilst you're waiting for an appointment or an assessment.
That's a really good point. What we'll do, we'll have a conversation with Suzanne at Citizens Advice. We know her well, clearly, and so I think that's really helpful.
I think they missed the trick there.
Yeah. And again, that's why I these Wednesday sessions are so helpful for us. We are sometimes that close to things. We miss something that's quite obvious. So thank you for that, Angela. The other thing that I heard, and again, I've been I'll slow down. Interested in your views. I heard anecdotally that some people were unwilling to download the app or get a test, because what it means is you need to self-isolate, and some people still didn't think that they were not going to comply with that because they just couldn't afford it.
Are you talking about my email that I sent you guys?
No, just more generally, Angela. That people are worrying about finances.
Yeah.
So do we have enough services available to advise what's available?
I don't know, because it's tricky, isn't it? Because if we're going to second lockdown now, more places are going to be shutting down because we're staying open, but for how long, I'm not sure. because we'll have enough staff or volunteers, but.
And again, it's really tricky. I wish I had answers for you all tonight. I really do. But, we were talking previously about tier 2, weren't we? And then we're talking about, are we, and then how we go to tier 3. We skipped that and went straight to tier 4. So Una and I have been probably about 15 times today going to the website to see if the latest guidance and more information's come out. But Una's going to talk about that in a minute. But I'm in the same position as you on many of these key things.
I think
any other comments?
Well, oh, sorry.
Okay.
Just what Angela said there, just about the uncertainty. People are quite stressed, job-wise, finance-wise, the uncertainty of what they can and can't do. So I think you hit the nail on the head there with that, Angela. I think we're all a bit unsure at the moment.
And you know what's really interesting, Una, and you've just kind of reminded me, and it was only last night I was at the Health and Wellbeing Board community subgroup. We were presenting around mental health services for adults and children and staff wellbeing. And there's been a huge increase in young people accessing mental health services. And the reasons that they are accessing those services are around stress, anxiety, and also those things around family problems and family debts. So it is really sobering. So we're working on a number of different things there. I can see we've got some hands up. Sorry, Karen.
Yeah, I just want to second. Can you hear me all right?
Yeah, we can.
Yeah. I just want to second the fact that people are feeling concerned, and some people obviously who are working and I've got friends who have now just immediately been put back on furlough, and that has been quite. I think they were quite surprised by that actually as well, and their salary drops. So there are all these financial implications. The thing that concerns me, and maybe I'm anticipating what we're moving on to. I'm looking at what's allowed to stay open. I'm looking at all the things to do with schools, colleges, universities, certainly locally. So you're going to see empty pictures maybe uptown. But there are lots of places that are probably going to be doing takeaways, I'm wondering how much traffic is actually going to be on that road and really how many people are going to be out and about. It concerns me a little bit that it is a very different beast this time round. And will it be sufficient?
It's very insightful, Karen. You're right. This lockdown 2, as people are calling it, is very different from the previous one, isn't it? We're being encouraged to exercise, which I think is a good thing, to get people out into parks and open spaces and taking some time to exercise. But so is your feeling that people will push that a little bit too much and they will be out and about collecting takeaways and various things?
I'm just curious to see what the drop will be on transport, what the drop will be, on public transport, and what the drop will be on the roads. If people, you've got to think if people are going to school and then they start having play dates afterwards, which is highly likely if it's been going on already, so why would it not? But that's my concern. I think there's a lot that it's going to be even harder for the police to kind of control and implement, any kind of reasonable fines or anything. But I do think there are just going to be far more people out and about.
Okay, yeah, and we can look at that. And again, I know that we get indicators on transport use. But again, this is, and Una's going to cover this, people should be staying at home. So it's going to be far more obvious when people are breaching those guidance. So it's going to be very clear what's going on. There shouldn't be play dates taking place. So that's going to be quite clear. And again, if you remember having spoken to Nick from Regulatory Services and Superintendent Roger, they are intelligence-led. So again, we had a conversation at the meeting earlier. We're going to reshare the contact details for how you are able to report a potential breach of those guidances. But very insightful, Karen. Thank you. Any comment? So you all know me well enough. You know I can't multitask. Any other thoughts about financial hardship, or are you happy to move on?
I was just thinking, Mary, that with financial hardship, information on things like access to food banks. I was doing a little bit of research on some apps, and I discovered Olio apps, which is quite interesting. It's an Olio. If you install it, it tells you about the distribution of food and people giving away food in your area. It's something that I saw on the Money Advice website, I think. But information on food banks and support that people can access because financial hardship goes hand in hand with sometimes food poverty or insecurity.
It does, absolutely, Karen. And that's really, if you'll share that with us, we'd love to have a look through to that information. And again, one of the things that we've been working hard with our colleagues in the community hub is, making sure we've got the right information for when you get those calls about how you can support people. There's many things that we don't know. And if our champions know about activities or apps that they think are helpful, please send them over to us. We can add to the directory and the things that we use, because we only know what we know about. So please continue to share that. That's really helpful.
Thanks, Larry. I think
yeah,
we move on just time-wise.
Sorry.
Does anyone else have any questions before we do move on?
What we'll do, Leoka, we'll share some information about food access and the community fridge and how people can access support from those the food banks and where donations can be made. Go ahead, Una.
Thank you. Well, some of you will have seen in the WhatsApp group, I shared a picture of the first draft of the COVID-19 Community Champions badge. And I see here I have two badges which look nearly identical. The heart in the middle on badge 1 is a slightly different color. It's green and fades into purple, versus badge 2, which is all purple. And we were just wondering if you would mind voting for which badge you would prefer to see for the champions.
We can't, I don't know about anyone else, but we can't see the badges.
Oh, has it not come up yet? Okay, it's on my screen. I think my computer's slowing down for some reason. Let me see if I can do this. Can you see that?
Yeah, that's fine.
Is that it there? Okay, perfect. So sorry. Badge number 1, it's a slightly different coloured heart to badge number 2. They're very similar, but we would just, if you wouldn't mind voting for which one you would prefer, you think is nicer for the champions, and if you'd wear one, and just pop it in the chat function, and then we will get going on the workshop theme. Let me see if I can move this. Can you all see that?
Yeah.
Perfect. Okay, so this week's workshop theme is on the new national restrictions, which come into place tomorrow. So the new national restrictions are in place from 1 minute past midnight, Thursday the 5th of November, until Wednesday the 2nd of December. And a quick overview of what they entail is you must stay at home. You must only leave home for food, medical, exercise, or work or education. You must work from home if you can. Avoid any unessential travel. Schools and essential shops will remain open. And to remember hands, face, and space. Oh, you can see that. Okay. So hands, face, and space. I just thought it'd be a good time to share this slide, as it's a key component of containing the virus. And we must remember to wash our hands and wash them regularly for 20 seconds. Wear a face covering if you're indoors, where social distancing may be difficult, and where you come into contact with people that you don't normally meet. and staying two meters apart from people that you don't live with, where possible, or 1 meter with extra precautions in place, such as wearing a face covering or increasing ventilation indoors. So what has changed? So the new restrictions will be in place 1 minute past midnight tomorrow, Thursday the 5th of November. And these restrictions will be in place for 4 weeks until the 2nd of December. So it includes no household mixing indoors or in private gardens unless in your support bubble. The support bubble is a close support network between a household with only one adult in the home and another household of any size. Stay at home, only leave for specific reasons such as education, work, volunteering, essential activities, so that's food, travelling for food or medication, going to a shop, childcare, providing care for vulnerable people, medical reasons, and to attend a funeral or a place of worship with individual prayer. Those schools and colleges and universities will remain open. We are encouraged to exercise outdoors, and you can meet one other person, not in your household or support bubble, outdoors, but to social distance. Pubs and restaurants are closed, but takeaways are permitted, as we heard earlier. Non-essential shops, so closed shops, leisure, entertainment venues will be closed. That includes gyms. And clinically vulnerable people are asked to be especially careful. So people are not being asked to resume shielding, but we are awaiting further guidance on this. And this is something Barry touched on earlier. There's still information that we are waiting on. That's to be updated, hopefully this evening or tomorrow. And protecting clinically vulnerable people is one of them. The government will write to everybody who is clinically extremely vulnerable to set out detailed advice with new restrictions in place. And the council will also be writing to clinically vulnerable people, clinically extremely vulnerable people. So the next slide, frequently asked questions. I've pulled together some of these questions which set out the guidance in a bit more detail, because I think when you just look at the slides like that, it's difficult to pick what certain people can do and in different situations. So the first one is, why have these new restrictions been imposed? So we've seen that the numbers in Merton, London, and the UK are rising. We need to reduce our day-to-day contact with other people to reduce the spread of the infection. And these measures are being implemented to reduce the number of cases, to stop the NHS being overwhelmed, and ensuring schools, colleges, universities stay open, and that as many people who can continue to work can do so. What areas do these new measures cover? So these new measures will be applied nationally. It won't be like the tier situation where the different rules apply in different areas, so this will cover the whole of England. And as I said already, the new measures will last until the 2nd of December. And at the end of this period, the government will look to return to a regional approach based on the latest data. So what if you cannot stay at home due to work or childcare or caring commitments? So there are a few reasons that you can leave your house, and we kind of touched on them a little bit earlier, but in more detail, you can leave for childcare or education if it's not provided online. You can leave for work purposes if your workplace remains open and you can't work from home. You can leave to exercise outdoors or visit a public place. And you can do this with the people you live with, the people in your support bubble. You can on your own, or with one other person from another household. And I'll go through that in a little bit more detail in the next slide. And this one is really important. You can leave for medical concerns, reasons, appointments, and emergencies, or to escape risk of injury or harm. So this is a really important point. The NHS is still open, and if you need to see a doctor or you have a medical appointment, you can still go. shopping for basic necessities, so food and medicine, but we are asked to do this as infrequent as possible, and to visit members of your support bubble or provide care for people, vulnerable people, or as a volunteer. So can you meet your friends and family outside in a private garden? No. So you must not meet anyone socially, indoors especially, with family or friends, unless they are part of your household or your support bubble. You can go outside to exercise or visit a public place with the people you live with, the person in your support bubble, or one other person outside your household. So outdoor public spaces include parks, beaches, the countryside, public gardens and playgrounds. But you cannot meet in a private garden, and that's the difference from the previous Tier 2 restrictions. What do you do if you start experiencing coronavirus symptoms? So this is the same as before. If you experience coronavirus symptoms, it's important to get a test, and that's still the same. You can get a test by calling 119 or using the link on the screen there, which will bring you to the national portal, and it will send you to your nearest testing site with availability. Can you visit a care home? So we're still waiting on guidance on care home visits at the moment. The last I checked this evening, it still hadn't been updated. But for now, you should follow the existing guidance, which states that you should not visit a care home except in exceptional circumstances. So to visit someone who is at the end of life. But this may change. We haven't seen the updated guidance just yet. Are places of worship still open? So places of worship are closed unless they're being used for funerals, to broadcast acts of worship, individual prayer, childcare, essential voluntary and public sector public services such as blood donation or food banks, and other exempted activities, which include support groups. And at the moment, for the next 4 weeks, weddings and civil partnership ceremonies will not be permitted to take place except in exceptional circumstances. Can parents and guardians access childcare? So yes, parents and guardians will still be able to access registered childcare and other childcare activities where reasonably necessary to enable parents to work or for the purposes of respite care. What if you are unable to work due to self-isolating as a result of a positive COVID-19 test or being asked to by the NHS Test and Trace? So if you're on a low income, and I think we spoke about this last week as well, but I thought it would be useful to still include it here. If you're on a low income and you've been told to self-isolate by NHS Test and Trace, you may be entitled to a payment of £500 if you cannot work from home and if you will lose income as a result. And I'll share the link to that again in the chat box this evening. Will shielding be on pause? So I spoke a little bit about this earlier. So people who are over 60, clinically vulnerable or clinically extremely vulnerable are encouraged to stay at home as much as possible, but can leave the house for exercise and are encouraged to do so. The government will write to everyone who is clinically extremely vulnerable, as will the council, to set out detailed advice where the new restrictions are in place. So at the moment, the current advice in place is for each local COVID alert area, and we are still waiting on more guidance on this. And the last question I've put together is, can you travel to another part of the UK if it's to a holiday destination or a second home? So we're asked to avoid travelling in or out of our local areas and reduce the number of journeys we make. You can still travel for a number of reasons. So if you're traveling to work, education, caring responsibilities, for medical appointments, or venues that are still open, such as essential retail, or to exercise if you need to travel a short journey to do so. And if you are traveling, we ask that, if you are traveling, people are encouraged to walk or cycle where possible and to avoid public transport. Overnight stays and holidays away from your primary residence will not be allowed. So this includes going abroad and in the UK, and it means you cannot stay in your second home if you have one, or stay with anyone that you don't live with or you're not in a support bubble with. Now, I can see that there's quite a few questions in the chat. I know that was a lot of information to go through. I'm just going to quick read.
Shall I pick one up there, Una? So there's a really, really good question. Lots of good questions. So dentists are allowed to remain open. Yes, the dentists are remaining open. They are part of the NHS infrastructure. We're going to be publishing something on our website, hopefully tomorrow or Friday, because today I've been speaking to the local dental committee. So we're going to get some advice and guidance on the changes that dentists are putting in place to keep people safe and to continue supporting people. So I can pick that up and we can send you that link. Kamiko's question, really good one, Kamiko. Kamiko, do you want to ask me the question rather than you hearing my voice all the time? No? Okay, so Kamiko's asked, are the restrictions based on any scientific evidence, such as where most transmission occurs? And then Karen said that's a really good question. It is, and that's the key question. And that is what we really do need to get over to our residents, that it is based on science. Absolutely. So just looking at my notes on that question. We know that this virus thrives on social contact. That social contact is through a range of different places. That's in a workplace, it's with leisure, it's within hospitality, so pubs and restaurants, and it's all through household mixing, which we've heard about before. And so the restrictions have been put in place from tomorrow to reduce people having contacts and social contacts across all those different settings. The reason that schools will remain open is because children are transmitting the virus far, far less. And so that's why they are staying open. And also, it's right that children continue to be able to access education. It's good for their health as well. So the key thing as well, so every day we get an update from the health protection team, so we can see where outbreaks are within the borough, within Merton. There was 4 in the most recent week. 2 of them were in a care home, which were picked up. This is positive. This was picked up by asymptomatic testing within the care home so that we can remove that member of staff because they didn't know they had the virus. So that helps us protect those care homes. One of them was in a workplace, and I can't remember where the other one was. But most of the virus transmission, as you've heard from me before, is through household mixing, and that's why those restrictions have been put in place. Kamiko, I hope that answers the question, but feel free to respond. And I can see that Karen's got a hand up too. So Kamiko, did you want to respond? Does that help a little bit? Karen, did you want to come in?
Yeah, because I think that's a question that comes up a lot, and it's really quite important to get as much data out there on this as possible. There's a lot of resentment about gyms closing, and there was something in the newspapers, but recently some research, and I think it's come from Track and Trace, and it's on quite a small sample size of a few hundred. And what it says, for example, is that 11.3 or 4% of cases were connected with supermarkets. But actually, that's not saying that they occurred in supermarkets. All it's saying in the data they've got is people had been to these places in the week before they got the virus. But it was one of possibly, and you'd expect a supermarket to be somewhere. And it was similar with the gyms. And I think sometimes that's I think it's a really difficult one, because they haven't had clusters in gyms because they're behaving as they should do. I think people need to realise that because restrictions are in place and people are, abiding by them quite well, I think, in a lot of gyms, you're not getting the clusters you had in South Korea that demonstrated where the problems lie with expelling air and, high intensity classes and things. And I think that there's a real message here between the scientific evidence and why people aren't seeing clusters in the areas that the evidence suggests they should be occurring, and people forget it's because we're doing a lot of really good things to prevent that happening. I think that's a really important point.
Yeah, thank you, Karen. That's really helpful. And again, if it was a straightforward outbreak in a particular workplace, a gym, a church, for example, we would go in, we would close that setting down and think, great, fantastic, all good. But this virus works differently. That community transmission is the key focus. But I agree with you. We need to get far better at getting our comms out. I need to get better at this. We need to do better. We need to do some local messages as well to use the data and the numbers, which you guys told me to do last week. So we're on it. Yeah. But your role as champions is really important too. I know you want to come back, Karen. But when we send you those messages on a Friday, please send them on to your networks and friends and networks. That's really going to be part of that solution. Go on, Karen.
I really want to get the message across about gyms, because I think that's going to be a bubbling problem and young people get a bit restless over that. Any data that says if you weren't doing all of these things and and anything about the dangers that still exist, because there are petitions that get started. You've had people refusing to shut, and you're going to find smaller gyms staying open, not the big ones. But I think anything on that front for young people, it's quite important, I think.
Yeah, thank you. And again, exercise is important for us. What we're doing as well, we're working with a network of our young inspectors, and we're increasing I'm working with you, some of the other components of my plan. I'm working with BAME Voice, a community organisation. I'm working with Merton MenCap to understand learning disabilities. I'm working with Merton Carers to understand that. But we're also working with young people to really understand what's going on in the community, because I can say we have got, and you've seen the video, I think, of Martin, one of our brilliant young people that is at university, lives in Pollard's Hill. We need to use local leaders, and that's how we're going to try to crack it. There's no one solution to this, but I've noted the point about gyms, Karen. Thank you. Really helpful.
The question from Leoka as well, is the Merton testing site still to be booked via phone, or is it now taking walk-ins? So at the moment, Leoka, it's still booked via phone or the national portal. It's not a walk-in testing site. I hope that's helpful. So the next question. Yeah, following up on Karen's point, it's also good for mental health of disabled people who use the gyms, as they can't access any other services. That's a really good point. And I think a lot of what we've spoken about in the last couple of weeks ties in with mental health as well. So, the financial restrictions, definitely there's a link there. Exercise, there's going to be a link, people isolating, people staying in their houses longer. And I think it'd be we have Merton Uplift speaking next week as well. But ensuring that we get the messages out there of what services that we do have and what can people access as well. I think that would be helpful. Kamiko, many people are frightened to use public transport because there was because that was associated with transmission. I saw an article arguing the evidence COVID. Oh, my screen's just blocked the question. There's new chats coming in. Sorry, COVID was not found on trains. Ventilation is key, but many buses have their windows shut. Why was this not given as guidance? So anytime I've been on a bus personally, the windows have been open. We are asked to reduce the number of trips that we make on public transport, but that's not always possible. People do need to use public transport. And I think it's just about having quite a number of people in a small area. So it's about making sure that we do wear our masks, we do sit away from people where we can, having those windows open. And yeah, as well, making sure people aren't frightened if they do need to use public transport, that by taking the precautions, they are protecting themselves and others.
Thanks, Ian. I just want to pick up a point that Angela's made. Angela, do you want to ask that question, or you'll make your comments? Because I'd like to respond to that, because I think you've raised a really, really important point.
Yeah, because I think sometimes people forget about workers that are in certain jobs, and we're all struggling with this virus and how to manage it. at the end of the day. And Wandsworth Council, because I also work in the borough of Wandsworth in a men's hostel, and they were offering like online support, mental health support for workers at the end of the day. Because I think we're forgetting people that work in the health workers and etc. like that, what they're seeing, what they're facing, and you've got no one to offload or share. Because all right, we keep saying this, spreading the word and doing this, but we need help ourselves.
Yeah, Angela, spot on. And again, it's a really, really important point.
But the balance is not.
No, carry on.
No, I was just saying it's the balance. You know, you're doing a job, we want to spread the word, but sometimes as well, there needs to be help for the people that are spreading the word. Or if you work in a certain sector, there's support need if you need help with your mental well-being. Because like I said, we're going to another second lockdown. In my other job, I'll be working like 7 days on the trot, 9 till 8, and trying to keep people happy at the end of the day. They've got their issues, but everyone's got their issues with this at the moment.
Absolutely. And no, Angela, I think you've raised an absolutely critical point here. You know, people on the front line are working incredibly hard in stressful, in challenging, difficult circumstances. We need to provide support to them. At the the Health and Wellbeing Board Community Subgroup yesterday, I had 3 slides, one on mental health services for adults, one on mental health services for young people, and one on frontline staff and volunteers that are delivering stuff across the borough. As part of that, we asked that community subgroup, what more stuff can we do to support the health and well-being of our staff and volliers? So we've got,
because I worked in this sector for a long time. Volunteers and key workers, they're more likely to have a breakdown. With the most highest sector to have a breakdown is volunteers, and key workers in this job role are more likely to get a breakdown.
Yeah, and again, yourself are doing amazing stuff on the front line, but you are going out to work to protect other people and putting yourself at increased risk. So we are working on mental health first aid and other programs and awareness training and others available online. What we're going to do, Angela, we will make sure that the champions are aware of those programs. Again, we will share it with the champions to amplify it. We're working through other routes to get that out, and I could just say, because this come from Wandsworth Council as well, because when we had it, the Wandsworth Council said, so I think you as a council, like with the voluntary sector that that are in place in Merton, you need to be sending off things as well, saying what's available, not just for the champion to do, but you could send it off to other little charity groups. Oh yeah, this is what we're offering. Yeah, we will. That we've started that network. We're starting getting those messages out. I think we're using the champions to amplify our existing work. But
which is good. But I'm saying for the champions that don't know other sectors, what's available in Merton for you to pick up and sidetrack. The other information that you think more support for the workers.
Yeah.
As well. Because like I said at the beginning, Barnet Council did a guideline for drop-ins, and that was Barnet Public Health. I did mention that a few weeks ago when we started, and I think Merton Council need to have something in line with that as well.
Yeah, and again, we're working closely with NHS colleagues. So the Merton Uplift Service, they've got a 24/7 line to be able to support people. They've got some real proactive online courses and messages that we can get out. I take your point, Angela. Yeah, it's a very good point.
Yeah, Barrett, it's not with the mental health one. With the Barnet template, it was like showing you how to run a drop-in. And even though we got our template, but that's from Barnet Council, was saying how feasible guidelines, to run it safely.
Okay.
I will send you what I was looking at, and I think Merton Council could do that and send off to a few charities, like for my drop-in, for instance, would be. Right.
No, do share us that information, Angela. Yeah, send us the information.
Yeah,
absolutely. That's the whole purpose of me being able to listen to you tonight. We can pick that up. No, thank you. Very aware of time. Karen, do you have a comment, or was that a previous hand?
I think that was a previous hand, but the only thing I did want to say is that there is evidence that the cleaning regime, masks and social distancing is making public transport safe. The only danger there is we all pile back on it.
Yeah, and again, the restrictions that come in place in 4 hours' time asks us to reduce that use of public transport. But again, that's to try to link that in. Lockdown 1 and lockdown 2 are two very different things, because we've put a lot of things in place that weren't in place back in March and April. So shielding's not back in place because we've got face coverings that are being encouraged people to be used. We've got those guidance. We've got rule of 6. We've developed a lot of other strategies to help keep people safe, including, as Karen's rightly said, that those cleaning regimes and risk assessments in workplaces, etc. So there's lots of things in place, but we need to do more on behaviour change. We need to follow the guidance, and we need to support and explain why people should follow that guidance really clearly. I'll hand back to Una just to close up. I'm very over a couple of minutes already, but these are so helpful sessions for us champions. Thank you.
Thanks everyone. That was really helpful. So apologies for running over. I'll go through this really quickly. There's been a lot of questions in the chat function, which is brilliant. I'll pull them all together and send them out on Friday with our responses. And our next drop-in meeting is Wednesday, the 11th of November, the same times, 12 to 1 and 7 to 8. And we'll be talking about Better Health Merton with guest speakers from Merton Uplift. Spread the key messages to your networks, just as we spoke about during the drop-in session. When we, it's great that we're able to share this information with you, but it's important as well that it goes further and reaches as many people as it can. If you could identify another person to join the network by next week, that would be brilliant. We're up to 94 at the moment, so it'd be great to hit 100 soon and just have as many people as we can. If you haven't already registered, the link to register is on the screen there. And as always, feedback to us what's working well and what isn't. So thanks everyone for giving up your Wednesday evening. It was great to see you all, and have a good week.